think about housing and childcare costs combined, our families are really struggling to be able to afford both. As we work to address affordability, quality, and supply, we really do that in partnership with our colleagues at the Department of Human Services, who will speak to you very soon about the employment-related daycare program, which works to make childcare more affordable for low-income families through the subsidy program. The Early Learning Division really has the responsibilities around building the supply of care. So we work to increase the supply of regulated care and address important health and safety issues through our licensing program. We support professional development and professional learning opportunities for our providers serving children starting at 6 weeks through elementary school, and we make investments in building a supply through programs like Spark, which I'll talk about, which allow us to help providers continue to improve and support their implementation of best practices. These efforts are primarily funded through the Child Care Development Fund, which is a federal block grant to support affordability, quality, and supply across all 50 states and all territories. The Early Learning Division serves as the lead agency for CCDF in our state. We receive about $100 million annually from the federal government, about 70% of which is transferred to the Department of Human Services for the ERDC program. Our supply building efforts really start with our licensing program, which touches over 100,000 children in our state, ages 0 to 12, and their families, and supporting approximately 3,800 licensed programs. Licensed programs can be registered family child care homes, they can be certified family child care homes, so larger homes, and they can also build centers. When you think about our licensing program, our responsibilities really begin with setting foundational standards to ensure children's health and safety in care, to be able to support and monitor providers to ensure that they are successfully meeting these health and safety requirements, and then in cases where providers are not meeting those requirements and some of their actions may increase the potential for harm to children in care, we carry out enforcement actions. The licensing program is housed here in Salem through a central office, and then we have 7 regional offices across the state. And most of the licensing program, again, is funded out of the Child Care Development Fund that I previously mentioned. We also build supply through targeted investments. As you will hear again from Dr. Pratt and Dr. Weber, all of Oregon is a child care desert when it comes to the capacity to be able to serve children in regulated care. So in order to ensure that there's a supply for those children and families most in need, we invest in programs that expand infant and toddler care to families in poverty or that are low income. So some of those investments look like investing in the early Head Start program. So again, that is a combined state and federal funds. Mostly federal funds allows 2,000 children, about 15% of all eligible children, to be able to have access to a child development program. We're also piloting a program right now funded through the Child Care Development Fund that I previously mentioned called Baby Promise, and this is an effort for us to expand and build a supply of affordable, high-quality infant toddler care and better support providers in targeted communities. So right now that pilot is operating in 3 communities. It is underway, and we're hoping to be able to expand this program as part of a recommended budget of Governor Brown. We also make investments to raise the quality of all regulated programs. Again, I mentioned previously the Spark program. This is what we call a quality recognition and improvement system. So what Spark does is it introduces a framework of best practices in early care and education to providers, beginning with licensing and helping them be successful in meeting health and safety standards, and then progressing in their practices. The Spark program combines sort of the technical assistance to understand these best practices and be able to implement them, as well as financial incentives and sort of addressing what are some of the cost barriers that providers may face and being able to increase quality. We see this program as really essential in, again, helping to build a quality supply, helping providers feel more supported and successful in meeting licensing regulations. think the best way to talk about what is a continuous quality improvement system, I think the impact that it has for children and families is with these two pictures I'm about to show you. This was a presentation that a provider from Southern Oregon made to the Early Learning Council, and this is a bilingual preschool promise provider who had been working through one of our focused child care networks and getting access to the technical assistance and incentives that I mentioned. So this was her home prior to the